Bismillahirrahmanirrahim. Assalamu alaikum. We start with the rhythm. We can see a P wave in the lead 2, so this is a sinus rhythm. After that, we count the number of boxes between the two R waves. These are about two and a half. If this would have been two, then we would have said that the rate is about 150. So here these are two and a half. So we can roughly say that the heart rate is between 100 to 110 per minute. Then we come towards the axis. We see that lead 1 seems to be downward and lead AVF seems to be upward, but this is not right axis deviation. Why? Because in the lead 1 we have the Q wave. If this would have been the S wave, then we could have say that this is right axis deviation. So when you find a Q wave rather than a S wave, you're finding a Q wave, you cannot label it as right axis deviation, because if this would have been S wave and this would have shown the downward deflection and AVF towards upward, then we would have say that this is a right axis deviation. But in this case, in the presence of Q wave, we say that axis is normal. So after that, we start looking at the PR interval, QRS complexes, ST segment depression or elevation along with T wave abnormality. Here we can see that there is a Q wave in the lead 1, and we see that whether this is following a vascular pattern or not. So in the AVL this is also present. So in the limb lead we can see that this is following a vascular pattern, and also in the lead V5 there is a Q wave, though this is not present in lead V6. But as lead 1, AVL and V5 are lateral leads, so we can see that there are Q waves in these lateral leads. And then we start looking at the ST segment. Here we can see that the ST segment is also elevated in lead 1, and again following the vascular pattern, if we see some change in in one lead, we try to look the changes in the other leads which are actually representing that wall. So as lead 1 represents the lateral wall, we see that there is ST segment elevation. Also there is ST segment elevation in the lead AVL. Apart from this, other lateral leads, if we see, we can see the ST segment elevation in lead V5 as well, and in V6 this seems to be normal. Then we start looking at the lead 2. Lead 2 is normal, lead 3 is normal, and here in the AVL, as we have discussed, that there is a Q wave in ST segment elevation. Lead AVF is normal. In the lead V1, we are able to find the first downward deflection, so there is a presence. This is a Q wave, again a W pattern. So this is a Q wave, and we can find a Q wave in lead V1, V2, V3 and V4, V5, as we have already discussed. Along with that, we are able to find ST segment elevation, not in the lead V1 but here in V2, V5 and V4, V3, V4 and V5. So what is the total assessment of the ECG? We have found Q waves in lead 1 AVL, V2 to V5, and raised ST segments in lead 1 AVL and from V2 to V5. So the total assessment is that we say that when there is presence of the Q waves, this means that there a certain time has passed the infarction. So this represents old infarction, but the presence of ST segment elevation signifies that there is the ongoing infarction present, or a present infarction is here. So we label the ECG as interolateral myocardial infarction of uncertain age in this case. Thank you.